The Democratic Republic of Congo has temporarily stopped tracking suspected Ebola patients in the eastern city of Beni. Following a weekend rebel attack, at least 16 people were killed, allegedly by a militia known as the Allied Democratic Forces. CGTN's Ocamringa has more.
The Congolese Health Ministry has directed health workers in Beni City to suspend visits to suspected Ebola patients. The directive was issued after a rebel attack in the eastern DRC city left at least 16 people dead and several others injured. A statement from the Health Ministry says the suspension is temporary and only applies to field activities that require health workers to visit households. Other areas of the Ebola response are reported to be operational. The locals in Beni recently staged a protest to express their disappointment with the government for failing to protect them during the rebel attack. The UN asked its staff to stay home to avoid confrontations with the angry residents. Health workers in the DRC are facing serious challenges of containing Ebola because of the insecurity in the area. According to the World Health Organization, 100 people have died of Ebola in North Kivu province since the start of August. Authorities in Beni suspect the Allied Democratic Forces to have carried out the attack in eastern DRC. Ocamringa, CGTN, Kinshasa, Democratic Republic of Congo.
The ongoing conflict in the Eastern Democratic Republic of Congo is making it difficult to contain the Ebola outbreak. The disease has claimed more than 100 lives, according to the UN World Health Organization. But frequent attacks in the same area are hampering efforts to stop the virus from spreading. A recent attack blamed on the Ugandan ADF rebel group on the city of Beni left close to 20 people dead. The latest clashes have forced the DR Congo government's health ministry to halt vaccinations and other activities, including tracing people who have been in contact with suspected Ebola patients. Across the border, health officials in Uganda are worried there is a high risk the disease could spread to the country as people flee the fighting. The Uganda Red Cross and partners have stepped up community education and heightened screening of people crossing from the DR Congo for signs and symptoms of the Ebola at the official and unofficial points of entry. This after the World Health Organization warned in August that insecurity in the region could affect the Ebola response. Michael Baleke, CGTN, Kampala, Uganda.